Hi, it's Dr. Thaker again, and I want to talk to you about pain management right here in beautiful Las Vegas, Nevada. And this is part of the wellness side of my practice, which is very important to me because chronic pain is such a debilitating problem suffered by so many individuals across Las Vegas and across the United States. And now I want to show you some other diagnostic techniques that we can use to find out what's wrong, what's causing the pain, so we can best treat it. Now, I spoke in the earlier video in this series about the most important technique for diagnosis, and that's listening. Now, I'm going to talk about some of the technology we use, along with the history we take and the careful physical examination. And in fact, some regard these techniques as an extension of the physical examination that's very important in pain management. So over here, what we have is this is actually an ultrasound machine that's specially designed to be used at the point of care or at the bedside. So instead of sending you to the diagnostic center for 3 hours to get some imaging done with an ultrasound or something else, I can do this during your office visit to help diagnose the cause of your pain anatomically, what's going on, as well as if I do a procedure for you, such as an injection or a nerve block or a sacroiliac joint for gluteal pain that's right in the back of your backside there on the side. I can inject and use this ultrasound while I'm injecting to increase the precision and the safety of the procedure. This is called point of care ultrasound, POCUS, some call it, or bedside ultrasound. And the other imaging techniques such as MRI or X-rays or a CAT scan, those are very important and those can be used also, but this is something we can do right in our own offices at the time of your visit. So that's the great benefit of point of care ultrasound, and it can be used to examine really most any painful area of the body, joints, limbs, any part of the musculoskeletal system, and the back and neck. It has some uses there as well. And what I want to show you is, I'm not sure about the screen right here if you'll be able to pick it up, but ultrasound is very simple. It's very painless. I'm going to use a little bit of this gel here just to show you. We use a little bit of gel, and some of the female patients out there will recognize some of this from which ultrasound? The baby ultrasound, that's right. This technology can be used for that too, but this device we have here is specially set. The depth of this is special for looking at the musculoskeletal system, looking at the joints, for example. So I simply am going to take this and I'm going to look now at my wrist, and I don't know if you can see with the camera resolution, but I'm looking at now the end of my radius, and I'm looking at the bones of my wrist, just like that, right at the bedside with this ultrasound device. And this can pick up different conditions, and it's very useful. What I was just showing you there for the wrist, it's very useful for looking at the anatomy of the carpal tunnel, because a lot of people have carpal tunnel syndrome. And you can look at the anatomy and you can see the compression, the narrowing of the carpal tunnel where the nerve goes through, the median nerve. And you can also pick up arthritic joints. You can see signs of arthritis. And very importantly, when you're doing a procedure like a trigger point injection, when you have a muscular pain, almost like a knot in your back that hurts, you can inject those with what's called a trigger point injection, which is a little tiny mosquito needle that relieves pain for many patients very effectively and right away. And you can also use the ultrasound and just this very small 7.5 hertz probe. You can use this to guide needle injections, for example, of arthritic shoulders or knees is very, very common and popular. So this is some of the high-tech stuff that we have. And this ultrasound device, you might have seen the same thing, and it's as big as it's almost as big as a motorcycle. It's very large. It looks like one of those old console TVs. Well, the technology has advanced and advanced to where I can take this very tiny laptop and this ultrasound device most anywhere. It weighs very little, 2 or 3 pounds, and they're very portable and they're very effective. The device is FDA approved. It's just the technology has grown and advanced, so everything's getting smaller in terms of all this fancy equipment that we use that can help patients. Now I want to talk about another extension of the physical exam. So after you come into Thaker Cosmetic and Wellness for pain management services, I have special training in pain management from the American Academy of Procedural Medicine. They issue a board certification for pain management that's for office-based pain management of the joints, the limbs, musculoskeletal system, headaches, the back, the spine. So when you come in seeking these services, we do a physical exam then, right? And then an extension of the physical exam are nerve conduction studies. And these are special diagnostic studies that consist of two parts, electromyograms and nerve conduction velocities. And I have some of this equipment right here to show you. And an electromyogram is taking this very small handheld device. It's very small, it hooks to a laptop, and it's small, but it's sophisticated, and it gets the job done. And this also used to be as big as one of those old-time computers with the cathode ray screen display. It used to be, a very large device, much bigger than even a simple laptop, like a PC computer, even bigger. Now it's this small, and it plugs into my laptop. And this device, I can use these knobs to change different parameters and to send a small electrical impulse into muscles or nerves to measure the muscles and nerves, to measure the signal they're giving off. And that allows me to detect problems of nerves, like we talked about carpal tunnel, the nerve going into your hand, which can cause hand pain, especially for people that are typing or waiters, people that are working with their hands, and nerves of the leg, like sciatica, which is the pain from kind of the back of your hip runs down the back of your leg. It can be helpful for diagnosing and confirming that. So, and also the junction between the nerves and the muscles. And this sends electrical signals with this part of the device, very small, pain-free electrical signals for most patients. Some patients even believe that this causes some relief of pain. And there are doctors that advertise that using these devices is for the treatment of pain. I use it for the diagnosis of pain because that's what's well established and proven in the literature. If other people are getting some other benefits out of that, well, that's great too. But what I would like to say is, these are the small electrodes that we attach to different parts of the limb that's being studied, and these are to pick up the signal and send it back to this machine so we can measure it on our computer. And just what you have here is we mark out certain distances with this white marking pen, and we measure you up with the tape measure. And this little ruler here is set up in advance to measure different parts of your hand and your leg, so we can measure the nerves and determine how fast the nerve conduction is through your nerves. So what I want to mention is sometimes, because people know that when we talk about the nerve conduction studies, we use needles, they say, well, I don't like needles, they're painful. And I just wanted to mention that I've done these studies and not even one drop of blood has been generated, not even a single drop. The needles that we use are incredibly tiny. I find the tiniest needles possible, and I've gotten some of these needles that we use, I've gotten those from a special company that just makes this kind of stuff, and they've made the smallest, tiniest needles that are relatively painless. I haven't seen a single drop of blood from the needle in some studies, and there are even patients that say doing the procedure causes some relief of pain. And if that happens, that's great. And what do we call that when we use needles? And these needles don't even have a hole in them. They're very tiny. What do we call that when we use needles and we put the needles in different areas where there's pain? What do we call that? We call that acupuncture. We call that acupuncture, and that's a well-known treatment for pain. So we're using these devices to diagnose pain. And the point I want to make is this is a very comfortable study. The electrical signals are very mild, and it is a very comfortable procedure. I don't believe it causes very much pain at all. There are some patients that report it actually causes a feeling of relief. And the important information that we get from this to diagnose your pain is invaluable. So we can look at the nerves, the sciatic nerve, for example, for pain down the backside, runs down your leg, the median nerve that causes carpal tunnel syndrome. We can look at the muscles for certain muscle diseases, because oftentimes we know a leg hurts or the arm hurts, but not why. So this is an extension of the physical exam. So I just wanted to share some of the techniques we use and some of the technology we use at Thaker Cosmetic and Wellness to manage painful conditions by getting a good, firm diagnosis. So please come in and see us. We're at 9420 West Sahara 105 at one of our locations. This is one of our locations here, which is also a cosmetic location for us. And regarding pain management, we have 4 comfortable treatment rooms. And give us a call, 702-545-0660, and check out our website, Thaker Cosmetic and Wellness, Thaker Pain and Wellness, as well as phaselaser.com if you want more information. Thank you very much. Nice to see you.